Your dog's limping. Find out how you can tell and exactly what you can do about it in this video. Hello, welcome back to my channel. If you're new, welcome. If you've yet to do so, I encourage you to check out my new supplement, Dr. Jones's Ultimate Canine Advanced Health Formula. I'll put a link in the box below for more information. So, Pipster, why are you limping? Any thoughts? Yes, it's a really common reason why you guys are visiting your veterinarian. Super common in our dogs. Pippy's doing a bit of limping. So we're going to be doing a lameness exam and show you how you can do it at home and give you some specific suggestions, natural remedies that you can use to help your dog. So the first thing, you need to be watching your dog walk. We've got to figure out which leg is sore, and that involves first getting them walking. We've got to figure out which is the sore leg. So I'm going to walk Pippy back and forth. You're going to see us go in and out of the screen. We're going to see if we can tell which part of which leg she's favoring. Come on, Pipster. Let's go. Good girl. All right. Come here. Good girl. Let's go. Come on. Good girl. Let's try it again. Now I'm going with plan B, which involves dog food, because Pippy didn't seem to be super motivated to walk around. But I know she's motivated for food. So let's see if we can actually see which leg she's sore on. Good girl, Pipster. Good girl. Good girl. Good girl. Good girl. She's slightly favoring her left rear. She kind of doesn't put quite as much weight on it as she did on her right rear. Let's try her again, see if you can see it. Okay, one more time. Pipster. Okay, good girl. With Pippy, this is kind of subtle. And in truth, I did a brief lameness exam prior to the video just so I could be clear and isolate which leg was sorest. But the first thing is just watching your dog walk. Typically, you're going to see them. They're hiking up one leg, well then it's obvious. And or often it's on the front leg. It actually looks like when you see their neck dropping down. It's called they'll go down on the sound leg. I'll just show you what that would look like. Pippy here were to be favoring her front leg when she walks forward, putting weight on, say, this front foot. Here, the front right, her sort of head would drop down at the same time. And often that's what you see, sort of down on the sound foot. So when they put weight on the sore foot on the front leg, they drop their head down at the same time. So that's another clue to find out which one is sorest. Okay, we're out here in the grass because it is kind of late spring, not quite the beginning of summer, but it's really nice out. Hence here we are. Okay, Pippy. So we know it's this leg, it's the right rear. And it was subtle, but as you can see her walking, she can sort of slightly favor it. She'd slightly sort of hike it up, maybe not put quite as much weight on that when she was going down on that right rear leg. So in terms of starting out doing the exam of that leg, assuming you think it's the rear leg, start it with the toes. Just want to have you guys just squeeze your dog's toes. See, are they sore anywhere in the toes? Moderate amount of pressure. Then you'll work your way up from the toes, being sort of systematic. Going into here, here into the wrist, right? The metatarsal bones, right? Above that sore. Then getting up into the hock or the tarsus. Gonna flex that and extend it, put a bit of pressure there. Doesn't really bug her. This big tendon here, the Achilles tendon or anconeus. Put a bit of pressure on the tip where it attaches here onto the olecranon. Is that sore? Nope. Nope. Let's flex and extend it, move it side to side, doesn't seem to bug her. Then sort of go up, sort of that leg, up the tibia. And what do we find? But yes, the knee. Super common cause of lameness. So I'm initially just flex and extend it. Doesn't seem to really bug Pipster here. Good girl. See if we can find what's sore in it. Okay, that's not really sore. Then sometimes what I'll often do too to see if there's any discomfort, often in the inside of the knee, called the medial portion, dogs that have had, say, an ACL strain will build up a bit of scar tissue. And it's called a medial buttress. Sometimes you can feel it. I can feel a slight one in Pippi's here. And the second thing I'll often find is if I put a bit of pressure there, they'll kind of pull the leg back as if it's sore. So if you watch me do it with Pippi here, when I put a bit of pressure on the inside of her knee, you're pulling that up a little bit. Oh, that's a little bit uncomfortable. Okay, so that leads me to think I need to do a better examination of her knee. Then what I'm going to do is then just sort of extend and flex this hip joint, see if that's uncomfortable. So she should let me just sort of pull it straight back. Go girl Pippi, let's see if you will. Seems fine. You know, when I'm fully extending out your hip, you, if anything, you want to play. So I would say your hip is not really bugging. I'm putting it, you can stretch your leg straight back. These dogs that have hip dysplasia, secondary hip arthritis, they're not going to let you do this. They'll find this to be painful. Whereas Pippi, she's okay with that. So maybe Pippi, you've strained your ACL ligament at some point. So the next thing I'm going to do, veterinary-wise, is I'm going to check to see just how stable this knee is. So with Pippi's knee, I'm going to check to see if she's got a thing called a drawer sign. So that's cranial motion of this bone, the tibia, in relation to the big bone above called the femur. And what I'm doing is I've got my left hand on the femur, my right hand on the tibia, and I'm putting moderate force to see if there's any cranial movement. And there's none, which is a really good sign. I'll flex it, sometimes do it in an extension. No, there's nothing there, Pippi, so that's a really good sign. So as I feel once again, don't feel any crunching or crepitus, so that's a good sign. No real sort of obvious arthritic signs. Although actually I do feel a slight click on extension and flexion in that knee. Yeah, there's a bit of a clicking going on there, Pippi. So that tells me that maybe there is a bit of arthritis, maybe she's got a menisci involved. And as I said, when I put sort of moderate pressure on the inside of the knee, you can call that where there's that medial buttress. Oh, it's sore. I'm sore. Oh, you'll pull your leg up. It's a bit painful. There, Pippi. What Pippi's done is strain the ACL ligament at some point. Who knows, just running around. Can go pretty crazy running through the woods. Strained it. That's her body's way to stabilize it. Form this thing called a medial buttress, which you have. But maybe you've got a slight bit of arthritis. Maybe she's lost a little bit of smooth cartilage. Hence, that's what I'm feeling, that slight click. So, assuming that's the case, what can we do to help her naturally? As we search through the woods for the rocks, what's coming on the top of the mountain? It's actually my rock wall. Ta-da! Well, there's a number of nutrients in my supplement, Ultimate Canine Advanced Health Formula, that can really help a dog such as Pippi, who's limping, who's got a slightly sore ACL. So the main big three sort of joint supplement ingredients include glucosamine, chondroitin, MSM, and those are in therapeutic levels. I have now increased amount of omega-3 fatty acids, so 1,500 milligrams per scoop. Along with that, I've added in 95% curcumin. And all of those can go a long way in helping any slightly arthritic dog. So Pippi, it is your lucky day, Pipster. See what she thinks about it. I think she'll just lick it up straight, but I'm sure of it. Okay, we'll just do a little test. It's orangey because of the curcumin, which is awesome. Such a great natural anti-inflammatory. And as you can see, Pippi likes it raw. No need to add it to your food. Good girl, Pippi. Ta-da. Yum. Another happy day at the Jones residence. You get more food to eat. Wow. Thanks so much for watching this edition of Veterinary Secrets. And if you've yet to do so, I encourage you to check out my new dog supplement, Dr. Jones's Ultimate Canine Advanced Health Formula. You can click the link in the box below for more information. Even Pippi says so.